In recent years, a growing body of evidence has been accumulated that computer support for clinical decision-making can make a significant contribution to improving outcomes in clinical practice. The CRADO system is being developed to assist cancer professionals in their decision-making, from first patient encounter through workup, treatment and follow-up. The CRADO trial will be a rigorous investigation of when, where and how best to provide these services in the management of breast and other cancers.
Hello, Mrs. Ellis. I'm Sister MacDonald. Nice to meet you. Don't think we've met before.
No, I don't come to the doctor.
CRADO provides a variety of different tools for different people at different times. Here it's assisting a practice nurse in taking the clinical history of a patient with breast symptoms. Not only does CRADO ensure that an appropriate and full history is recorded, it can also advise the nurse whether the patient requires an urgent referral according to national and local guidelines. If a referral is needed, an appointment can be made at the breast clinic automatically, and all relevant patient data passed through to the clinic team.
I can't remember anybody else. I mean, definitely not my mum, not my sister. I haven't been able to get hold of my mum yet, but she would definitely know me. She knows everything.
Okay,
she knows everybody in the family.
I mean, if you could ask her, it is really important.
Oh, absolutely.
Okay, and then you can log the answer into CRADO, and then the doctors can read it there.
Oh, that's good. Great.
Okay, Mrs. Ellis, so I've logged in all the information and my examination findings into the system, so let's see what happens. Okay. Right, it's telling us that you need triple assessment tests at a specialist breast clinic. Okay, now, the great thing about this is it arranges the appointments automatically.
Oh, great.
Okay, now, this is for you, all right? That will take you straight to the CRADO site, and you'll be asked some questions about your family history.
Okay.
Now, the more you can tell it, the happier it'll be. All right?
I'll do my best.
Okay.
There have been many attempts to use computer systems to improve patient care, usually focused on individual steps in the journey, such as diagnosis or treatment selection. However, modern cancer care is a complex series of interlocking pieces. The CRADO project has established that there can be as many as 65 different points in the breast cancer journey where significant clinical decisions have to be taken. And, if they are not taken correctly, the best outcome will not be achieved and there will be a possibility of patient harm. CRADO takes a unified approach, providing a comprehensive set of decision-making, planning and communication tools for everyone involved.
Sorry, Mum, what year was that? Oh, okay. And there's nobody else? No, it's all right, Mum, it doesn't matter, it's just they want the family history.
Clinical genetics is increasingly important at many points in the patient journey, and CRADO can help the GP or oncologist take a high-quality family history and carry out an accurate risk assessment. Many CRADO services can be available to patients themselves. Here we see CRADO guiding the patient through the process of taking her own family history. This saves specialist staff time, and the family data recorded can be very accurate.
No, look, don't worry. I'll let you know when there's any news, right? Okay, thank you, thanks. Bye.
Hello, Mrs. Ellis.
Yeah.
I'm Mr. Booth, one of the surgical registrars.
Hi, nice to meet you.
Hi. I understand you've come to see us because of a lump.
Yeah.
Okay. And I see you've put your family details into the computer. How was that?
Oh, fine.
CRADO will provide unobtrusive access to electronic patient records throughout the patient's care. The potential to give practical assistance in making decisions about the choice of imaging modality and type of biopsy to be ordered, for example, has also been clearly shown. Furthermore, CRADO can flag up a patient's eligibility for participation in clinical trials and reduce administrative demands on staff by scheduling tests and clinical procedures automatically.
Name, Eve Ellis. Hospital number 1472003. Initial assessment.
Computerized dictation of clinical notes is well established in some specialist areas of oncology, like pathology reporting. However, it's now becoming practical for computers to interpret spoken commands and information, as well as simply transcribe and record data. Recent CRUK research has shown that speech and language processing systems can capture spoken information flexibly and with high accuracy. In this pathology scenario, Credo interprets what the pathologist says, recognizes the need for a histological diagnosis, and suggests an appropriate course of action for the pathologist to confirm.
Next case.
Is there much difference between the two? How's that? Hey, do you want some milk?
Yeah.
What's it? Okay.
Okay, kids, you done yet?
Yeah.
Right.
Hello again, Mrs. Ellis. Nice to see you.
Yeah, and you.
So, you've come back to see us for your results?
Mm-hmm.
Okay, I'm sorry you had to have... I'm afraid to tell you that your lump is a tumour.
Okay.
Okay.
Cool.
So don't need to know now, but I would like to know within the next few days.
All right.
So what I'd like you to do is to go home,
Mm-hmm.
have another think about it.
Mhm.
You can look at pretty much the same information as you can see here on your Credo website. Discuss it with your husband, okay, and have a think about it. Okay, I don't want you to make a decision now.
No, we'll have a look tonight, and I'll try and let you know tomorrow.
Okay, that would be great.
Yeah. Okay, so we're looking at either the full mastectomy or it's the wide local incision and then all the radiotherapy and all that.
From the patient's perspective, Credo has two main benefits. It can help in gathering information, as we saw in Eve's family history. And it can assist patients to make more informed decisions by setting out the pros and cons of treatment options which are specific to their individual circumstances and preferences.
Well, I'm actually only going to have, it's only going to be about an hour or two there, but I'm going to feel like,
Okay. Well, I guess we've got to go with that now.
Hello, Mrs. Ellis. My name's Dr. Williams. I'm one of the oncology registrars.
nice to meet you.
Nice to meet you. The other thing that I do need to discuss with you today is the fact that you're actually eligible for a trial with drugs with fewer side effects.
An important feature of Credo is its ability to automatically identify patients who are eligible for clinical trials, notifying staff of suitable open trials and facilitating recruitment. This helps clinicians and researchers to match up patients with projects, as well as identifying the personal benefits for the patient of enrolling and ensuring the patients make better informed decisions, as well as helping with research. Techniques that are being developed by CRUK show that Credo can also help to personalise standardised care plans to accommodate individual patient needs and preferences.
Once we come to a decision together, okay, about which treatment plan you'd like to go down, then we'll let Credo help us prepare your plan for us.
Okay.
Okay. Thanks very much.
Thank you.
Credo can also help the patient manage her treatment diary. Although the system can respond flexibly to personal constraints and timetables, it will never allow changes to be made that would adversely affect the treatment being given.
How are you, Mrs. Ellis?
Feeling great, thank you. Absolutely fine.
Excellent. Well, I'm delighted to tell you that all your recent tests have come back completely normal, which is really good news.
Oh, that's great, yeah. So, I mean, really, What's the chances of it recurring now?
Okay, well, if breast cancer is going to recur, by and large it does so within the first 10 years.
Mm-hmm.
Perhaps it would be helpful if we look at the figures together on Credo.
One of the things that computers are good at is doing tricky calculations. To answer Eve's question about recurrence, we see Credo recalculating the risk based on national data and personal and family history. CRUK research has shown that tools of this kind help with explaining and communicating complex ideas about risk and other information to patients, and are welcomed by clinical staff.
Okay, very good. Well, I'm looking forward to seeing you next year. But if you do have any problems before then come back and see us straight away, okay?
I will, and thank you for everything.
That's our pleasure, Mrs. Ellis.
Thank you.
This film has illustrated some of the ways in which advanced informatics technology can help busy clinicians ensure the highest quality care for their patients. The technical feasibility of all of the Credo systems we have seen has been demonstrated by CRUK, and in most cases objective evidence of clinical benefit is already available. A fully integrated version of the system is still in development. But once this is complete, the Credo trial can start in earnest, allowing us to establish whether cancer informatics services for the clinic are as significant as they currently seem.